Welcome to the video about the symptoms of kidney failure. This video will talk about the symptoms of kidney failure that few people talk about. Has getting out of bed been harder lately? You go to sleep early, try to eat right, maybe even take your vitamins, but somehow, every morning feels like a struggle. You wake up tired. Tasks that used to take minutes now feel like mountains. Maybe you've told yourself it's just age or stress, but what if your body is actually trying to warn you about something much more serious right now? Your kidneys could be silently failing. And the most dangerous part, you wouldn't even know. There's no pain, no flashing warning sign, just a slow, quiet decline that millions of Americans are experiencing every single day without realizing it. In fact, more than 37 million people in the United States have kidney disease right now, but over 90% of them have no idea. No diagnosis, no treatment, just hidden damage, building silently in the background, while their bodies carry on as usual. Until one day, it's too late. Your kidneys are more important than most people realize. These two small organs filter more than 50 gallons of blood every day. They remove waste. They balance fluid levels. They help control blood pressure, regulate minerals, and keep your bones and muscles working right. But when they begin to fail, your body doesn't stay silent forever. It starts to send you signals, soft ones at first, then louder. The problem is, those signals often look like ordinary things. Fatigue, swollen feet, brain fog. It's easy to miss the truth behind them until the damage is severe. This video is here to help you catch those signs before it's too late. Because today, you'll discover 13 early warning symptoms of kidney failure that often get ignored, overlooked, or misdiagnosed. These are not just random aches and pains. They are deeply connected to how your body functions. And they are backed by scientific research, real patient stories, and data from leading kidney health experts. If you or someone you love is over 60, this could be one of the most important videos you watch this year. Because early detection could mean the difference between a simple blood test and years of dialysis, between independent living and permanent fatigue, between life as you know it and life changed forever. So now, let's begin with the very first symptom. It's one of the easiest to ignore, but also one of the most dangerous if missed. It starts by stealing your energy little by little, and it might already be happening to you right now. Number 1. Fatigue that feels like your body is shutting down. You sleep 8 hours but wake up exhausted. Your muscles feel heavy. Coffee barely helps. Simple chores leave you winded. This isn't normal tiredness. This is deep fatigue, and it could be your kidneys trying to warn you. When kidney function starts to drop, toxins begin building up in your bloodstream. These waste products affect every cell in your body. But the most damaging part, your kidneys stop producing enough erythropoietin, a hormone that helps make red blood cells. With fewer red blood cells, your body delivers less oxygen to your brain and muscles. That's why you feel drained, weak, and mentally foggy. A study in the American Journal of Kidney Diseases found that over 60% of people with chronic kidney disease suffer from anemia-related exhaustion long before they ever get diagnosed. Feeling like this daily, ask your doctor for a blood test that checks red blood cell count and kidney function. The earlier you act, the more strength you can regain. But just knowing this isn't enough, because what comes next is even more dangerous. Number 2, swollen ankles that don't go away overnight. Feeling tired is one thing, but when your ankles start to swell and your shoes suddenly feel too tight, that's your body shouting louder. Persistent swelling, especially around your feet and ankles, could be a massive red flag from your kidneys. Healthy kidneys remove excess sodium and fluid through urine. But when they begin to fail, that fluid has nowhere to go. It seeps into soft tissues, pulled down by gravity, creating puffiness that doesn't go away with rest. Socks leave deep marks. Shoes feel tight by noon. And unlike salt-related bloating, kidney-related swelling often worsens each day. Kidney health journals confirm that edema is one of the earliest signs of fluid imbalance caused by reduced kidney filtration. Over time, this swelling can move up your legs and even appear in your hands and face. If this sounds familiar, talk to your doctor about a urine test to check sodium and protein levels. The earlier you intervene, the better your outcome. But just knowing this isn't enough, because the next warning sign might be hiding in your toilet. Number 3, urine changes. That whisper trouble before you feel pain. Swelling might be visible on the outside. But what if the warning signs are hiding in something you flush away every day? Changes in your urine are often the earliest and most ignored signs of kidney trouble. Maybe you've noticed persistent foam or bubbles that look like beer suds. Or you're waking up multiple times at night to pee, or the color shifts to dark amber or even pink. These are not normal. Foamy urine often means protein is leaking through your kidneys, something that should never happen. According to the Clinical Journal of the American Society of Nephrology, proteinuria is one of the first detectable signs of kidney damage. And nighttime urination, called nocturia, suggests your kidneys are struggling to concentrate urine properly. If these signs sound familiar, ask your doctor for a urine protein test and GFR check. Early action can protect your filtration system before it collapses. But just knowing this isn't enough, because the next symptom might leave you gasping for air. Number 4, shortness of breath that sneaks up when you least expect it. Foamy urine may signal protein loss, but when walking across the room leaves you winded or you feel like you're running out of air after climbing just a few steps, your kidneys might already be sounding the next alarm. This isn't about being out of shape. It's about your body being flooded from the inside. As kidney function drops, fluid begins to build up in the lungs. That makes it physically harder for oxygen to reach your bloodstream. And at the same time, your red blood cell count may be dropping due to low erythropoietin. A study in the American Journal of Kidney Diseases found that shortness of breath is a top symptom reported by patients in early kidney decline. It often masquerades as aging or heart trouble, but the kidneys are the hidden culprit. If you feel breathless doing simple tasks, ask your doctor for lung imaging and kidney function tests immediately. But just knowing this isn't enough, because what's happening in your gut could be just as dangerous. Number 5, nausea that feels like your body is rejecting itself. Breathlessness is scary, but when your stomach turns for no clear reason, something deeper may be wrong. Sudden waves of nausea, vomiting, or loss of appetite, especially without food poisoning or illness, could be a silent scream from your kidneys. This happens when damaged kidneys can no longer filter waste properly. Toxins begin to build up in your blood. This condition, called uremia, irritates the lining of your stomach and disrupts the appetite center in your brain. You may start rejecting foods you used to love. Even water can make you feel queasy. According to the National Institute of Diabetes and Digestive and Kidney Diseases, uremic toxins are directly linked to persistent nausea in patients with early kidney failure. This symptom often appears weeks or even months before diagnosis. If you feel sick often without an obvious cause, ask your doctor for blood tests that check urea and creatinine levels. Your body may be trying to detox without the tools it needs, but just knowing this isn't enough, because the next symptom doesn't just affect your skin, it drives people mad. Number 6, itching that feels like it comes from deep inside. When nausea steals your appetite, it's hard enough. But when your skin begins to itch like something is crawling underneath, it becomes unbearable. This is not dry skin. This is kidney-related itching, and it can drive people to the edge. As kidney function declines, waste products like urea and excess phosphorus build up in your blood. These toxins irritate nerve endings under the skin, creating an itch that lotions cannot fix. It's not on the surface. It's internal, constant, and it doesn't go away. Clinical studies show that up to 90% of patients with advanced kidney disease experience chronic itching, and many report that it gets worse at night, disturbing sleep and damaging quality of life. If you've been scratching without relief, especially across your back, arm, or legs, ask your doctor to check your phosphorus levels and kidney function panel. Treating the cause, not the symptom, is the only way out. But just knowing this isn't enough, because the next symptom can turn every bite of food into a metallic nightmare. Number 7, a metallic taste that ruins every bite. If constant itching wasn't enough to wear you down, imagine this: your favorite foods start tasting like metal or blood. Every meal becomes unpleasant. You chew, but the flavor's off. Something feels wrong. This strange metallic taste is more than annoying. It could be a red flag from your kidneys. When kidneys stop filtering waste efficiently, toxins like ammonia and urea linger in the bloodstream. These compounds affect both your taste buds and your sense of smell. The result, a sharp, bitter taste that makes food unbearable and leads to sudden appetite loss. According to the National Institute of Diabetes and Digestive and Kidney Diseases, metallic taste is one of the most underreported early symptoms of kidney failure. It can also lead to unintentional weight loss and poor nutrition in older adults. If food has lost its flavor or leaves a strange aftertaste, ask your doctor to evaluate your kidney function and toxin levels. But just knowing this isn't enough, because the next symptom may strike in the dead of night with pain that makes you bolt out of bed. Number 8, muscle cramps. That jolt you awake at 2 a.m. After days of metallic taste ruining every meal, your nights suddenly get worse. You're jolted out of sleep by a cramp so sharp it feels like your muscle is tearing apart. This is not a random Charlie horse. It could be your kidneys struggling to keep your minerals balanced. Healthy kidneys regulate crucial electrolytes like calcium, potassium, magnesium, and sodium. But when function declines, those minerals swing out of control. The result, painful and unpredictable muscle cramps, especially in your legs and feet. According to Kidney International reports, electrolyte imbalances caused by kidney dysfunction are a major trigger of nocturnal muscle cramps. These aren't tied to exercise. They hit when you're resting. Often, they worsen over time and may lead to dangerous falls in older adults. If this sounds familiar, get your blood electrolyte levels tested and ask about kidney filtration rate. Proper hydration and mineral support can bring relief, but just knowing this isn't enough, because the next sign may affect the sharpest tool you have, your mind. Number 9, brain fog that makes you feel like a stranger in your own mind. First, your body hurts. Then your thoughts start slipping too. You walk into a room and forget why. You reread the same line 3 times. Your focus drifts. Your memory fades. This isn't normal aging. This could be a kidney warning hiding in plain sight. When kidneys fail to filter toxins, those waste products begin circulating in your bloodstream and eventually reach your brain. They pass through the blood-brain barrier and interfere with memory, clarity, and decision-making. You might feel mentally slower or emotionally flat. According to the American Journal of Nephrology, cognitive dysfunction linked to kidney disease is often mistaken for early dementia, but it can be reversed with treatment if caught early. If you're forgetting simple things more often or struggling to focus, ask for a kidney panel and check your eGFR score. Your mind might not be failing. Your kidneys might just be overwhelmed. But just knowing this isn't enough, because the next symptom shows up right where you see it first: your eyes. Number 10, puffy eyes that reveal more than a bad night's sleep. When your brain feels foggy, it's easy to overlook what you see in the mirror. But if you're waking up with persistent puffiness around your eyes, day after day, your kidneys might be calling for help. This isn't from crying or a late-night snack. Puffy eyes, especially in the morning, can be a hidden sign of protein leaking through your kidneys. When your kidneys are damaged, they can't hold on to essential proteins like they should. Instead, that protein escapes into your urine, disturbing fluid balance and leading to swelling in the delicate tissues around your eyes. According to research in kidney health journals, periorbital edema is one of the earliest outward signs of kidney dysfunction. And because the skin around your eyes is so thin, it often shows this imbalance before the rest of your body does. If your eyes seem unusually swollen or baggy, ask for a urine protein test and a basic kidney panel. But just knowing this isn't enough, because what's coming next can raise your blood pressure literally and dangerously. Number 11, high blood pressure. that refuses to come down after seeing puffiness around your eyes? It's easy to check your blood pressure. But what if those numbers just keep climbing? When your blood pressure stays high, despite medications or lifestyle changes, it could be a sign your kidneys are under serious stress. Your kidneys and blood pressure are deeply connected. Healthy kidneys help regulate blood volume and control hormones that affect your arteries. But when they start to fail, they may retain excess fluid and produce more renin, a hormone that causes blood vessels to tighten. According to the Journal of Hypertension, chronic high blood pressure is both a cause and a result of kidney damage, forming a dangerous cycle that accelerates failure. If your readings keep rising or your meds stop working, ask for a kidney panel that includes eGFR and creatinine levels. Treating the root, your kidneys, may be the key to stabilizing your numbers. But just knowing this isn't enough, because the next sign may show up on your skin and it's easy to overlook. Number 12, dry and flaky skin that doesn't improve. No matter what you do, you've managed your blood pressure. But now your skin tells a different story. It's dry, flaky, itchy, and no amount of lotion seems to help. Could this be the weather or aging? Maybe? But when dryness becomes constant and widespread, it might be your kidneys failing from the inside out. Your kidneys do more than filter blood. They also balance essential nutrients like calcium, phosphorus, and vitamin D, key players in healthy skin. When kidney function drops, these nutrients fall out of balance, affecting your skin's ability to retain moisture and regenerate. According to the International Journal of Dermatology, skin issues are often one of the earliest external signs of internal kidney dysfunction. And because people treat it like a cosmetic issue, the real cause gets missed. If your skin feels tight, scaly, or itchy without a clear reason, ask for labs that assess kidney minerals and filtration levels. The solution might be more than skin deep, but just knowing this isn't enough, because the final warning sign could be hiding in something far more alarming: your weight. Number 13, sudden weight loss and appetite that disappears overnight. After dry skin and strange cravings, there's one symptom that's hard to ignore. You start losing weight fast. Not because you're trying, not because you're exercising. It just happens. And food no longer excites you. Your appetite disappears and people start asking if you're okay. This is one of the most dangerous signs of kidney decline. When your kidneys can't filter toxins, waste builds up in your blood and disrupts the hormones that control hunger. You may feel full without eating or even develop an aversion to food altogether. According to nutrition in clinical practice, unexplained weight loss combined with poor appetite is a strong predictor of advancing kidney disease, especially in older adults. This leads to malnutrition, muscle wasting, and rapid energy decline. If your clothes are fitting looser and your meals feel forced, ask your doctor for a kidney function test and metabolic panel immediately. Acting early can stop this spiral before it becomes life-threatening. But just knowing this isn't enough, because what you choose to do next may decide how your health unfolds from this moment on. If you've made it this far, you're already doing more than most, because now, you know. You've learned the 13 early warning signs that your kidneys may be in trouble: fatigue that never lifts, swelling that won't go away, brain fog, night cramps, skin problems, appetite loss. These symptoms are not just part of getting older. They are signals, your body's way of asking for help before the damage becomes irreversible. The good news is, you can still take control. Most kidney problems progress silently, but they don't have to. By recognizing the signs early and speaking with your doctor about a simple blood and urine test, you can slow or even stop the damage. Ask about your eGFR. Ask about protein in your urine. These tests are fast, safe, and may give you back years of strength, energy, and independence. You're not alone in this. Whether you're watching for yourself or someone you love, what you choose to do next truly matters, and we're here to guide you every step of the way. At Senior Health Tips, we're committed to giving you clear, science-backed information that empowers you to live stronger and longer. We cover practical food choices, safe exercises, supplement tips, and daily habits that help protect your kidneys and your entire body. In our next video, we'll reveal the 7 common foods that can silently damage your kidneys over time. Some of them might already be in your fridge or pantry right now. Don't miss it. If you found this video helpful, please save it to your library so you can return to it anytime. Like the video to support our channel and subscribe for more health tips that truly matter. Because your health doesn't have to decline with age. You have the power to protect it starting right now. Let's take that next step together. Your future self will thank you for it.